Good day, everyone. Today, we're going to talk about rheumatoid arthritis. Rheumatoid arthritis, or RA, is a chronic inflammatory disorder that affects the lining of the joints, causing painful swelling that can eventually result in bone erosion and joint deformity. Arthritis is any disorder that affects joint. It can cause pain and inflammation. Rheumatoid arthritis is the second most common type of arthritis. The joint most commonly affected are the wrist, hand, knees, ankles, and feet. It typically occurs at the same sides of the body. It can also affect other organs of the body such as the eyes, skin, heart, lungs, kidneys, nervous system, and digestive tract. Rheumatoid arthritis is an autoimmune disorder. This means the body attacks itself by mistake. In RA, the immune system attacks joint and organ tissues. Here's how it happens. The white blood cells of the immune system move into the joint. They release chemicals called cytokines, which attacks the cells of the synovial membrane. These chemicals cause synovial cells to release other destructive substances. They also cause synovial membranes to grow new blood vessels and form a thickened area called a pannus. As the pannus grows, it invades and destroys area of cartilage and bone inside the joint. Inflammation causes buildup in the joint, making the joint swell. Eventually, without treatment, the joint space narrows and ankylosis can occur. This is fusion or growing together of bones in the joint. This results in the loss of the ability to move the joint. Diagnostic and laboratory procedures. Physical exam. The doctor will check the joints for swelling, tenderness, and range of motion. RA tends to strike several joints. Antibody blood tests. Doctors look for certain proteins that show up in the blood when the patient has RA. These proteins mistakenly target healthy cells and kick off the inflammation process. So a high or positive result means inflammation is in the body. Other blood tests could include complete blood count or CBC. It helps the doctor find anemia, which is common in RA. Next is erythrocyte sedimentation rate. This measures how fast the red blood cells clump and fall to the bottom of a glass tube within an hour. C-reactive protein. This test measures levels of a protein your liver makes when inflammation is present. Next is imaging tests. This can help your doctor judge how severe the disease is and track its progress over time. Causes or risk factors. Sex. Mostly affected with this disease are women. Age. Mostly diagnosed with RA are middle age. Family history. Smoking, exposure to asbestos and silica, and obesity. Pathophysiology. Genetics. Environmental triggers such as infections and smoking, sex hormones is the start of RA. Macrophages and dendritic cells are thought to present instigating antigens to T cells, causing T cell activation and proliferation. Activated T cells produce inflammatory cytokines and stimulate B cell differentiation into plasma cells. the inflammatory response is systemic. This leads to decreased production of hyaluronan, which is a major lubricant in synovial fluid, inflammation, increase in matrix metalloproteinase production, and increased cartilage damage. Plasma cells antibodies form immune complexes, indirectly damages the cartilage. This tree leads to joint damage that recruits neutrophils, T cells, and B cells into joint space, causing hyperplasia and angiogenesis of synovial membrane. Neovascularized hyperplastic synovium invades and enzymatically destroys joint tissue. Joint tissue includes ligaments, cartilage, and subchondral bone. This eventually leads to untreated severe rheumatoid arthritis that will affect the entire body. Signs and symptoms: tender, warm, and swollen joints, weight loss, fever, fatigue or tiredness, stiffness in more than one joint, weakness, and loss of appetite. Treatment for RA: NSAIDs. Non-steroidal anti-inflammatory drugs can relieve pain and reduce inflammation. Steroids. Corticosteroid medications such as prednisone reduce inflammation and pain and slow joint damage. Disease-modifying anti-rheumatic drugs. These drugs can slow the progression of RA and save the joints and other tissues from permanent damage. Biologic agents. This is also known as biologic response modifiers. These are newer drugs of DMARDs or disease-modifying anti-rheumatic drugs. These drugs can target parts of the immune system that trigger inflammation that causes joint and tissue damage. Surgery. Synovectomy. This surgery is to remove the inflamed lining of the joint, which is the synovium. It can be performed on knees, elbows, wrists, fingers, and hips. Tendon repair. Inflammation and joint damage may cause tendons around your joint to loosen or rupture. The surgeon may be able to repair the tendons around the joint. Joint fusion. Surgically fusing a joint may be recommended to stabilize or realign a joint and for pain relief when a joint replacement isn't an option. Total joint replacement. During joint replacement surgery, the surgeon removes the damaged parts of the joint and inserts prostheses made of metal and plastic. Nursing diagnosis. These are the nursing diagnoses can be used in caring for patients with rheumatoid arthritis. Acute pain as evidenced by reports of pain or discomfort. Impaired physical mobility related to skeletal deformity as evidenced by inability to purposely move within the physical environment. Disturbed body image related to changes in ability to perform tasks as evidenced by negative self-talk. Self-care deficit related to musculoskeletal impairment as evidenced by inability to manage IDLs. Risk for impaired home maintenance related to long-term degenerative disease process. Deficit knowledge related to condition as evidenced by inaccurate follow-through of instructions related of preventable complications. Nursing interventions. For relieving pain, provide a variety of comfort measures. Administer anti-inflammatory, analgesic, and slow-acting anti-rheumatic medications as prescribed. Individualized medication schedule meet patients' need for pain management. Encourage verbalization of feelings about pain and chronicity of disease. Assist in identification of pain that leads to use of unproven methods of treatment. For reducing fatigue, explain how to use energy conservation techniques. Identify physical and emotional factors that can cause fatigue. Facilitate development of appropriate activity or rest schedule. Encourage adequate nutrition, including source of iron from food and supplements. Increasing mobility. Encourage verbalization regarding limitations in mobility. Assist to identify environmental barriers. Encourage independence in mobility and assist as needed. Allow ample of time for activity. Provide rest period after activity. Reinforce principles of joint protection and work simplification. Facilitating self-care. Assist patient to identify self-care deficits and factors that interfere with ability to perform self-care activities. Develop a plan based on the patient's perceptions and priorities on how to establish and achieve goals to meet self-care needs, incorporating joint protection, energy conservation, and work simplification. That's all for rheumatoid arthritis.